Lucy Richardson was used to a full and active life, despite having a number of health conditions that weaken her immune system. When the COVID-19 outbreak reached New York, her doctor advised her to take standard precautions, such as frequent hand washing. But concerned that wasn't enough, she chose to self-quarantine at home because of the threat of the coronavirus.
I'm at higher risk of getting it. I'm at higher risk of complications if I get it. And finally, I'm at higher risk of not receiving treatment. You know, there's a lot of talk about deprioritization. And for me and for a lot of other people, we are very concerned that if we present in a hospital, we might not be the ones that they want to treat.
60% of adults in the US have a chronic illness like heart disease or diabetes, and earlier CDC research showed nearly 3% of Americans were immunosuppressed. Many cancer patients face a difficult decision when treatment might increase risk of infection.
There are a number of reasons that cancer treatment may be stopped. Some of it has to do with concern about inducing immune suppression, and part of it has to do with the simple logistics that they don't have resources available because so many resources have been directed towards COVID-19. But yes, doctors and patients are having, and families are having a lot of discussions about perhaps altering treatment programs.
Some people living with chronic conditions have complained of a lack of information and guidance on how to stay safe during the outbreak. The CDC says people with weak immune systems should continue medication and contact a healthcare professional if they have any concerns. And the Department for Health and Human Services says hospitals cannot ration treatment based on disability status. But there are doctors who believe COVID-19 will have serious long-term implications for those living with underlying health conditions.
I make the analogy to my patients. I said after 9/11, which we went through here in New York in 2001, I said going to an airport was never the same. It's unpleasant, but we've kind of gotten used to it. And I sort of have the feeling for quite a while, until there's a really great vaccine, that we're going to need to be mindful of these precautions.
Lucy worries she'll be trapped in her apartment until that happens. In the meantime, she's working from home and trying to stay positive. Sarah Walton, CGTN, New York.